what should make them think, hey, maybe a sleep study would be helpful?
Okay. Yeah. So you would be a very, if I'm allowed to, can I speak about you
You can
personally? Yeah.
absolutely, yeah.
Yeah. Okay. Topic that's of great interest to me, and I can explain where it extends into other areas of my interest and research. But you as a group, a population, represent individuals who, for whatever reason, because there are many triggers, have come to a point of um, loss of reserve, energy reserve. And that's how I look at this complex of disorders that Ellie's outlined, whether it be fibromyalgia or chronic fatigue syndrome or any other of the conditions, and now long COVID, which in our day, in our day, way back 30 years ago, would have been mono, would have been the viral illness that would have triggered other people's progression down this road. And some of you, of course, are probably those people. So I think it's really important. I would actually argue that not all of you have terrible sleep.
Hmm.
Some of you actually sleep fine, I'm sure, but you're just tired when you wake up. So that's a very important thing to distinguish from those of you who cannot sleep. Like you would say to me, because I'll always say, well, why are you here? Or what's your concern about your sleep? And people, well, I can't sleep. Or it's, you got to tell me a little bit more about that. And so it's from our perspective, from a sleep doctor's perspective, can you fall asleep? Can you stay asleep? Can you finish your sleep? Or any one of those three or all three? Or do you sleep, but you wake up unrested? So that sort of gives you that starting point of, okay, there's a problem and we need to look at that. Sorry,
So,
my
Dr. Samuels, would any of those be situations where people would consider a referral? Like they're not falling asleep, they're not staying asleep, they're not getting enough sleep, or they think they're sleeping, but they're still waking up exhausted?
Well, it's a little more complicated than that because we
Okay.
have people from all over North America because you've got Americans here
Yeah.
from different states and you've got Canadians and the care from a sleep perspective is vastly different as it would be in your discipline. You know,
Hmm.
it's not routine family medicine, routine psychiatry, et cetera, et cetera, et cetera, where you have access to those experts. So it's really important to understand that many of the people on this webinar actually don't have access. So
That's
people,
true.
for instance, in the East Coast, on the East Coast, they have no access to the kind of service that we have here at the center. And I mean, last month we were referred 650 patients. So we
Wow.
exceed 500 patients a month, you know. And with between both clinics, the Sleep Institute and the center, it's close to 800 a month. So you have to understand that volume, you know, it probably exists in the Maritimes, but does not get served. And so your access to service is critical here. And
Hmm.
that limits whether someone will even try. So just look at your mentor, Dr. Stein, waited 30 years. And I would see her patients, she would refer them, and I'd think, geez, why doesn't Ellie come? And you know, look, it's doctors. We just don't get help. You know, this is our psychology, right? Oh, I don't need that. And then when I sat down and started talking with Ellie, because she would sort of say, well, you know, I don't want to burden you. I don't want to bother. It's like, you know, this is why I exist. People will always say, well, I don't want to bother you. It's like, well, this is my job, right? So this is why I'm here. And family doctors will say, well, we don't want to refer because, you know, you're too busy. Well, our wait list is to see a doctor is less than 8 weeks, and to see the behavioral sleep medicine team is less than 12 weeks. So that's very short when it comes to sleep medicine in Canada. Wait lists to the foothills are 2 years, for instance, right?
Wow.
A wait to get into the sleep lab is 1 month. Once you've seen the doctor or the behavioral sleep, you'll be in within 4 weeks. So you have to understand access is critical.